Hi, my name is Sarah Davis, and I'm going to be performing MAR version C for you today. As you can see, I wrote it down on a piece of paper so you could follow along. Now, before I start, I just want to mention that I'm going to integrate I'm going to integrate patient identification using appropriate, according to my agency policy. Sorry. So, according to my agency's policy, I have to identify patients with their name and date of birth and check that with their armband. And then I just want to also mention that I'm going to also be preparing meds for just one client at a time, and that because it looks like I'm giving insulin, I want to check what their blood sugar was and whether or not they've eaten. Okay, so I have my MAR, and now I'm ready to go and do my first check at the medication dispensing system. Stop it, Whittle. Okay, so I have my medication dispensing system here, and what the screen would look like, so I can compare it like on the Pyxis or the Omnicell, so I can compare it with my MAR. Okay, so again, I have my MAR right here. With this, I'm just going to ensure the correct client name, patient identifier, medication, dose, route, time, documentation, and drug allergies. So it looks here like I have Jane Doe, date of birth 1/23/27, Jane Doe 1/23/27. Medication, regular insulin 56 units, subcutaneous daily. Regular insulin 56 units, subcutaneous daily. Time 8 a.m., time 8 a.m. No known allergies, no known allergies. And last blood sugar was like, I don't know, it didn't tell us, but let's say it's 120. Okay, so after we checked all that, the medication dispensing system will pop out the med, and bam, my insulin. Now I just want to, I'm just going to, at this point, select my syringe and consider the volume, type of medication, adipose tissue mass, and injection site. So I selected 100 unit syringe since we're giving 56 units. And I have to plug my phone, I have to plug my computer in, so bear with me. And I'm experiencing some technical difficulties. Bear with me, I'm so sorry. Okay, computer is plugged in, I'm sorry. Okay, so back to my video. Okay, I did my first check. I selected my syringe. The injection site, I want to preferably give it in the abdomen since the abdomen's the best site for insulin. I also want to make sure that it's 2 inches away from the umbilicus, rotating sites. So if it was in, I would rotate sites, and either put it in the upper right quadrant, upper left quadrant, lower right quadrant, or lower left quadrant. Okay, so I have my syringe, I have my vial, and I'm ready to prepare my medication and do my second check. Okay, so I have my MAR. There we go. With this, I'm just going to ensure my correct client name, patient identifier, medication, dose, route, time, documentation, and drug allergies, and expiration date. So, Jane Doe, date of birth 1/23/27. Jane Doe 1/23/27. Date Medication, regular insulin, 56 units subcutaneous daily. Regular insulin, 56 units subcutaneous daily. Time 8 a.m., 8 a.m. No known allergies, no known allergies. And documentation. Okay, so I have all that. Since I'm using a vial, I'm going to be using an alcohol pad and scrubbing that for 15 seconds. In a circular motion. Okay, now I can draw my air into my syringe, which is going to be typically the same volume as my medication, which is 56 units. Okay, so now that I have this, I just want to mention that I'm going to insert the needle bevel up and angled through the center of the vial, atop avoiding coring, and inject air to air. So I'm going to take my cap off, set that like that so I can recap it later. Sorry, you can't see it. Okay. Okay, so I have my vial. Gonna straight down, air to air, flip it out backwards or turn it around, do the hokey pokey. And when you're pulling your med, make sure there's no air bubbles. If there are, work them out. They will come out. Okay. So I'm going to withdraw 56 units. Okay. Now I'm going to recap using one hand, scooping, and now I can, there we go. And I can set that to the side. Okay, so that was my second check and preparing the meds. Now I'm ready to go to the bedside and do my third check. So I'm going to take my MAR with me and act like I'm entering into the patient's room. Hi, my name is Sarah Davis. I'm going to be your student nurse today. Can I have your name and date of birth? I'm going to foam in, perform hand hygiene, integrate appropriate standard precautions, hand hygiene, safety, privacy, and body mechanics, put on gloves. So I asked, hi, my name is Sarah Davis. Can I have your name and date of birth? And she would tell me Jane Doe, 12327, which she did. So at this point, I'm going to check her wristband. So I'm at the bedside. Here I have her wristband. It says Jane Doe, date of birth 12327. It is in fact Jane Doe. Okay, so now I'm going to go on with my check and just make sure I have the correct medication, dose, route, time, documentation, drug allergies, and expiration date. So I have medication, regular insulin, 56 units, subcutaneous daily. I have regular insulin here. As you can see, I have 56 units. Okay. Time to be given, 8 a.m., 8 a.m. The medication does, in fact, say 56 units. No known allergies. I'm going to ask Jane Doe. Jane Doe, do you have any allergies? Just to make sure that she has no known allergies. It says right here there's no known allergies, but I just want to make sure. So she, at this point, she would tell me no known allergies. And then I'm just going to check the expiration date. So again, it says July 2027. We're good. Okay. So I'm at the bedside. I did my hand hygiene and donned my gloves. Now, things that I'm going to also do is I'm going to ask Jane Doe, where would you like me to put the inject this medication or administer this medication? And she would tell me in her tummy, in the upper right quadrant. And I'm going to consider again the injection site. If I can pinch less than an inch at the base, I'm going to go in at a 45-degree angle, but pinching. If I can pinch greater than an inch at the base, I'm going to pinch and go in at a 90-degree angle. And if I can pinch greater than 2 inches, I'm still going to go in at a 90-degree angle, but I'm going to pull that skin taut. Now, Jane Doe, she is she's a regular stature. I can pinch an inch on her tummy, no problem, and that's good. So we're going to pinch an inch and go in at a 90-degree angle. So, let me just see. I think, yeah, I'm good. I'm just thinking. I just want to make sure that I mention that when I do inject the medication, I'm going to press my plunger slowly to inject the medication at a rate of 10 seconds per milliliter. And then I would remove the needle smoothly along the line of insertion. So yeah, I'm going to give my med now. So, going to pinch an inch. Go in at a 90-degree angle, inject my med, pull out smoothly, engage that safety, immediately put that in the sharps container. I'm grabbing my sharps container. And then I just want to gently blot the site with a gauze pad. Pretend this is a gauze pad. I'm not massaging the site. And then I'm just going to remove my gloves and perform hand hygiene again before leaving the room. And then I just want to make sure that before I'm all said and done, I document that this medication was given. And where it was given. So it was given, I think, in the upper right quadrant. Yeah, the upper right quadrant. So I'm going to document that, the time, the route, everything. So yeah, I think that's everything. I hope you have a wonderful weekend, and I hope nursing's, yeah. Yay, nursing school! Have a good one.